Hello everyone, hope you're doing good. I'm Arya from eGlobalDoctors. If you are new here, let me tell you, eGlobalDoctors is a secure platform through which we offer the world's best available medical treatment to every person in need, irrespective of where they are living. With a click of a button, we bring the most experienced, well-respected, highly qualified medical personnel to those who need it. So for any health-related issues and specialist consultation, visit www.eglobaldoctors.com and register yourself to schedule an appointment. So welcome to another video of Doctors Answering the FAQs. Today, we'll be answering all of your questions related to this COVID third wave and how it can affect especially the pregnant women. So without a delay, let's start today's video. We have Dr. Maya Nambisan today joining us from California, USA. She's a board certified OBGYN with a master's degree in public health in infectious disease epidemiology. Dr. Maya will be answering the FAQs in this video today. So let's start with it.
Hi, Arya. Thank you for inviting me to speak with you about COVID-19 and pregnancy.
So, in this third wave that is predicted to be starting in India, how much risk do the pregnant women have?
Well, pregnant patients have a greater risk of getting COVID and severe COVID due to the Delta variant. Studies have shown that the prevalence of severe COVID in pregnant patients with the first wave during the original outbreak was only about 5%, which was much less than we thought it would be. However, currently, though we are still amassing data, it's clear that there's about a 10 to 15% risk of severe COVID with the Delta variant. And this is primarily due to the fact that this particular variant is much more transmissible than the original.
So, Dr. Maya, how can COVID actually affect pregnant women?
Well, the symptoms for pregnant women in the mild cases are very similar to those in non-pregnant women. In fact, the most common symptoms with mild COVID in pregnant women, as reported by the CDC's Pregnancy and Infant-Linked Outcomes team, showed that cough, headache, and muscle aches are very common in mild COVID in pregnant women. However, many pregnant women could be asymptomatic or without symptoms. And studies have shown that pregnant women are more likely to not show symptoms than non-pregnant women. The other confusing detail is that many of the pregnancy-related symptoms are very similar to COVID, mild COVID symptoms. Fatigue is very common. Nasal congestion can be very common. So these are some things that, they're important to know for both the woman herself, the pregnant woman herself, and her physician. If there's a high rate of COVID in the community, then these types of symptoms need to be further investigated in a pregnant woman. Pregnant women are more susceptible, however, to severe COVID. And this is because of the changes that occur during pregnancy. The hormonal changes make it more likely that edema can form, swelling can form in the respiratory system. And this makes it much more likely that they may need intensive care admission and eventually ventilator dependence. And this is the case actually for many respiratory infections, including the flu. But because, again, this particular virus gets transmitted much more rapidly, much more easily, COVID is a bigger threat to pregnant women. Pregnant women, infants, their fetuses, their babies can be much more at risk as well. So there's a higher risk of preterm delivery. And this could be done iatrogenically with the OBs trying to manage a pregnancy, a very sick woman who has COVID-19 and is pregnant. We may deliver the baby earlier to make it easier to manage our patient. It could be because severe infection can promote or provoke preterm labor. There's also a risk of intrauterine growth restriction, so smaller babies perhaps, babies less able to thrive for that reason. And there is a higher risk of miscarriage. So it's not something to be taken lightly.
So, should women who are trying to get pregnant take the vaccine?
This has been debated quite a bit. And in the United States, the American College of OBGYNs, as well as the CDC, have come out with a statement stating that absolutely pregnant women, along with every woman, should get vaccinated against COVID. And I will include your fourth question about women who are interested in assisted fertility. Basically, across the board, women should get vaccinated with the COVID-19 vaccine. There's a registry started at the beginning, at the inception of the vaccine drives in the United States, called the V-Safe trial. And this was conducted by the CDC. And in it, there was about 139,000 women who were pregnant at the time that they received the vaccine. And they have been followed through time for adverse reactions. And there have been no statistically significant adverse reactions for the woman or her fetus with getting vaccinated. Now, it's true that primarily the vaccines that were tested were the mRNA vaccines here in the United States, but the other vaccines are equally safe with certain caveats. For instance, the live attenuated or the vaccines that have virus particles in them, but they are not active, not live, those are very common in pregnancy. We give those types of vaccines for the flu and for whooping cough prevention. So that should be completely safe. With these vaccines, the concern was the adjuvant given, but that is very similar. The adjuvant used for the COVID-19 inactivated virus vaccines are very similar to those used in flu and Tdap, and so we believe that they are quite safe. The other thing is that we really have to weigh the benefits and risks. Every time we offer a medicine or an intervention, that has to be weighed. And when it comes to the potential reactions or outcomes from the vaccine, from getting the vaccine versus from not getting the vaccine, well, we think get the vaccine, have potentially a strong immune response, and you may feel quite weak and tired. You may have a slight fever. You may have experienced muscle aches, but this might be due to simply a very strong immune response. So it's much safer to get that and to deal with that in the short term than to deal with the sequelae of a severe COVID infection, which means ultimately the possibility of spending time in the intensive care, being ventilator dependent. And even if you survive that, there is many years of recovery and rehabilitation that's necessary for many of these women who have needed ventilator support. So in conclusion, yes, it is recommended that vaccines be given to women who are pregnant and women who desire to become pregnant and women who seek out artificial reproductive techniques to become pregnant. Across the board, women should be getting vaccinated.
And can the COVID be transmitted to the baby while breastfeeding?
This is possible. The baby COVID can be transmitted to the baby during breastfeeding. It is important during that time to exercise caution, wash hands, mask, and really taking those precautions may minimize the risk of transmitting COVID during the breastfeeding process. It is recommended that patients continue to breastfeed. And in fact, with COVID positive patients, there's the possibility of passing on good antibodies to the baby through the breast milk as well. So breastfeeding is ultimately recommended. You just have to take some precautions.
Okay. So which vaccine in particular is safe for pregnant women?
So the mRNA vaccines were the ones that were studied most in the United States, and they have been considered overall through research, through the mechanism of action of these vaccines, and through animal models to be considered safe. In addition, as we spoke about a little bit earlier, that V-Safe trial, that registry that was conducted by the CDC from the beginning of the vaccine drives in the United States, have shown that overall these vaccines are pretty safe. Some of the other vaccines, such as the J&J, are also considered safe There's the caveat that it can cause thrombocytopenia or low platelets in very rarely. And this may be a consideration in some women who experience gestational thrombocytopenia, which is a particular reaction that happens in certain pregnant women where the platelets drop simply due to the pregnancy. With regard to Indian vaccines such as Covishield, the most common adverse effects are mild injection reactions and immune reactions, but there is a 1 in 100,000 risk of blood clotting. And women who are pregnant are more at risk for blood clots. And so this should also be discussed with your provider if you are considering taking the Covishield vaccine. Covaxin is an inactivated virus, and this is similar to the other viruses we discussed, the flu vaccine and the pertussis vaccine. And for that reason, they are considered safer because they're so similar to vaccines that we traditionally use in pregnancy.
So the new mothers who are the new mothers right now, so they can breastfeed even after taking the COVID vaccine?
Yes, and it is encouraged. Studies have shown that there is transmission of antibodies, which we call passive immunity, to the infant through the breast milk. And so that should be done. There have been no adverse outcomes with breastfeeding after the vaccine in pregnancy, according to the registries and trials that are currently going on.
Can this COVID-19 be passed from a woman to her unborn or newborn baby?
Yes, it can. And it can happen in 3 different modalities. One is in utero. This is called vertical transmission. Then there is intrapartum during labor and delivery. And finally, there's postpartum. Of the 3, vertical transmission, in utero transmission is very unlikely. We have seen in numerous cases that pregnant women with severe COVID have not given birth to COVID positive infants. The greatest risk is postpartum, and this is where mothers who are severely ill may need to be isolated from their infants. They are able to give breast milk, but they should mask and wash their hands when they do so.
What protocols should the pregnant women follow if ever at all diagnosed with the COVID?
Well, the pregnant patients should follow the same protocols as any woman who has been diagnosed with COVID. They should isolate from the onset of symptoms for about 10 days. They should definitely get tested. And even if the testing is negative, if they continue to have symptoms, they should continue to isolate for those 10 days from the onset of symptoms. They need to monitor for respiratory deterioration. And the recommendation then is to, if you have the ability and access to a pulse ox, to check your oxygenation when you're walking, when you're doing a little bit of exercise. Just walking to and fro in the room for 6 minutes will do. If the numbers go down, then you may need to seek shelter, a treatment in a tertiary care center where they can care for the newborn baby who may be preterm and care for the pregnant patient should they become severely ill.
So yes, those were the questions I had, and it was a really great information that you shared. And I'm sure a lot of women who are pregnant, they must be worried about this whole pandemic and third wave situation, worried about themselves, their babies, and their families. So they would get a really good help from this video after watching it. So really, thank you so much for
Thank you so
joining
much, Arya.
the Global Doctors. Yes.
Thank you very much. Take care.
Thank you, Dr. Maya. Yes,
Bye-bye.
take care. Bye. Thank you all for watching. I will see you in the next video.